Hi, my name is Austin Matunowitz. I'm with CFD Research, and I'm excited to give you a little more context into our recent vestibular rehabilitation project. The vestibular system contributes to a person's ability to maintain balance and their sense of proprioception. The sensing organs are located in the inner ear. Vertigo is a common form of vestibular dysfunction. As a person ages, their vestibular system tends to deteriorate. Over 50% of individuals 65 and over have a form of diagnosable vestibular dysfunction. This dysfunction is a leading factor in falls among this age group. Vestibular rehabilitation, a form of physical therapy, has proven to be an effective treatment. The Visual Ocular Response Level 1 exercise, or VORX1, is commonly used. It involves a patient focusing on their finger about arm length away while shaking their head as fast as possible. Try this yourself for 30 seconds. You'll likely feel a little sick. Because of this, vestibular rehabilitation patients have a lower adherence to their prescribed at-home exercise program than other physical therapy patients. As you can imagine, this delays how quickly they improve. Furthermore, even when they do comply, clinicians have no way of knowing the quality of their at-home exercises. This project was an NIH SBIR Phase 1 with the goal to improve vestibular rehabilitation of older adults. We created an app where patients play games that mimic their at-home exercises using inertial measurement units, or IMUs. The IMUs track their motion as well as the optotype or character on the screen to play the games. The app then uses the IMU data to compute range of motion and velocity metrics, which are then sent to a clinician web portal. In the web portal, therapists can track their patients' adherence as well as their performance. The app also includes instructions on how to play the games, how to perform the exercises safely, and several clinically validated questionnaires. Our collaborator at the University of Pittsburgh, Dr. Sue Whitney, tested 6 patients above the age of 65, performing VORX1 pitch and yaw exercises normally and with the use of our app. Afterwards, subjects completed a dizziness handicap inventory and filled out a survey concerning their opinion on the app. In addition to these qualitative results, we examined the average peak ranges of motion and velocities to verify that patients performed the exercises similarly with the app as they would with the conventional method. Because this was a preliminary study with few participants, no statistical analyses were performed. Quantitatively, we found that the range of motion and velocity were generally similar. The angles for the range of motion were measured against the initial position of the subject's head before collecting data. Both methods showed the extension angle to be larger than the flexion angle during pitching motions, with a slightly larger difference among the app results. The app results are better in line with neck range of motion from literature. The app also showed better symmetry during range of motion for yaw than the traditional method. Both of these results are positive because some of the goals of the VORX1 are to challenge a patient's range of motion as well as to prevent them from decreasing their range of motion during the exercise. The game was set to be played at 100 degrees per second. Both the app and the traditional methods hovered around this value. However, both showed large standard deviations. In the app, this is most likely due to different methods of completing the game task, which requires subjects to avoid pillars. Subjects most likely slowed down throughout the trial during the traditional method. Qualitatively, we also found that participants generally enjoyed the app. The participants with more severe vestibular dysfunction tended to rate the app less favorably. In anecdotal feedback, participants who gave negative responses indicated that the exercises were not explained clearly enough, and that more opportunities to practice the games at a slower pace would improve their experience. In conclusion, this study demonstrated a novel application of gamification to vestibular therapy among older adults. Preliminary testing indicated similar range of motion and velocity between the app-based therapy and conventional therapy. Additionally, over 50% of patients responded positively to the survey in all categories. Those that did not stated that not knowing what to expect reduced their overall enjoyment. These and other responses collected will be used to improve the app and games in the future. Overall, this work demonstrates that gamification can be a valuable tool for increasing adherence to at-home vestibular therapy exercises while preserving the important biomechanical characteristics of conventional exercises.